One of my most watched videos is about round ligament pain, and I totally understand why, because sometimes you get a round ligament pain and you're like, my uterus just exploded. And so you look to social media to see if you're going to live. I'm so glad that you guys love that video, but I wanted to jump into some of the most frequently asked questions in there so that we can review them together and get some answers, because round ligament pain can actually be really scary because it is so sharp, like somebody's stabbing you. As a side note, I actually re-released this as a podcast episode. So if you're interested in podcasts, having me in your ears when you go for your curb walking, you can find my podcast. I'll link it down below as well. Attention, attention, paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you. Okay, let's jump into those comments. At 3:22, someone said, I was experiencing this pain. Get a firmer type of pillow and place it under your belly uterus and hold it there as you cough. It helps. Absolutely. Ligament pains can happen a ton when you are coughing. So if you grab a pillow and you splint it over that area, it can be really helpful. We actually do this after you have a C-section as well. So I think that can be really helpful. Again, it's tips like this that a lot of people learn in physical therapy, but I love to give these kind of tips online because obviously that's a really simple one that can make it easier, especially for my mamas out there that have a cough or cold or the flu. It can be really miserable and tough on your ligaments, and so they will take it out on you. Yeah, tell me in the comments, when you cough or sneeze, do you get these types of pains? And have you tried splinting your belly with a pillow? Something to think about. And I actually mentioned this in the video. I have a comment thanking me for putting in the video, but I think it's such an important tip. I wanted to put it in this video as well. Now, while these can happen early on in pregnancy, most often they're happening later in pregnancy. So if you are in your third trimester, I actually have a whole third trimester checklist pack that I can send you guys. It's totally free. I'll link it down below. Okay, we get somebody else who said, I am now on day 4 of this pain. Is it normal? Now, if you have a continuous stabbing pain, you need to go into labor and delivery or be seen at your provider's office. That is not normal. Most often a ligament pain is like somebody stabbed you, took the knife out, and then it kind of goes away after a minute or two, and it should start to abate. So you're going to get a very sharp initial pain. Think stretching a rubber band. And then as the rubber band relaxes, the pain is going to dissipate a little bit. Now, of course, I recommend that everyone watch that full video, but as a reminder, your ligaments are little bands that kind of come off of your uterus and attach it to your abdomen so it doesn't just like float all around your belly. And so as your uterus grows, those bands get angry. When you cough or sneeze, again, your abdomen tightens up and those bands get angry as well. So ligaments are sort of just the rubber bands that hold our uterus inside our body. That's the Cliff Notes, but I would definitely recommend the full video. And of course, I'm going to link the full video down below for you guys. And as a side note, if you are having these types of pain, it is still important to bring it up to your provider. I just put it on YouTube because I know a lot of people are worried that they're dying, and I want to give you those fast answers while you're calling your provider to say, no, it's not super unusual, especially this sharp pain. A lot of times you feel it along the sides of your abdomen, and so that can help people feel a little bit more comfortable, because I hate it when people think they're dying when they really are not. It's just your uterus fighting back at you. Okay, now we have somebody else who says, the pain happened now on the left side down below my ribs. I had to lie on that side to rest. The pain kind of is sharp, happening every 5 minutes, but not severe. Should I see a doctor? So usually with ligament pain, it's not going to creep up every 5 minutes. That tends to be contraction pain, right? Contraction pain, you'll notice, goes every 3 to 5 minutes. Ligament pain tends to be a one-time event, often associated with something. You're getting out of the car, you're standing up, you're coughing, you're sneezing. Versus contraction pain is going to, come in those waves frequently. So if you're having this pain frequently, call your provider, especially if you're early on and we think you shouldn't be going into labor. We'd want to make sure that it's not preterm labor or something else. And as a side note, bladder infections can actually give sort of a stabbing pain as well, and that has a fix to it versus ligament pain, not as much of a fix to it. So that's something to think about as well. Okay, next comment. Thanks a ton. I've been experiencing this pain since late first trimester. I've just entered my third trimester, experiencing it every now and then. Talked with my doctor since the beginning, and he's like, it's normal and no real reason. I'm glad that I came across this video of yours. At least I'm less worried and I know what's happening, though I don't like them very much. Yes, they are miserable, but a lot of times information can make them a little less miserable. That's why I had it. And I just want to say they can happen very early in pregnancy, which really catches people off guard and makes them worry extra because they think that they are miscarrying. But as this uterus starts to stretch, those bands, like a rubber band, are not prepared to stretch with it. And so in the beginning, and sometimes your baby gets growth spurts in the womb, you'll notice these ligament pains a little bit more frequently. Again, talk with your provider just like that gal did, but knowing why they happen and some things that you can do to help them, which I go over in that full video, which I'll link to down below, can be really helpful. Okay, my next comment, and this one's my favorite. She says, "You've been a nurse since 1997. You look so young." You are my favorite. Thank you so much. Yes, I got my LPN in 1997 and worked for a pediatrician. Then I got my RN in 1998. And then I started labor and delivery in 2001. So I have been around a long time, but thank you for the compliment. I appreciate that. And as a reminder, which I talked to in the video, this is something that I would see so often in triage. And I felt like we could save you a triage copay if you knew that this was kind of normal. So it's a great thing to talk with your provider about at your appointments so you're not left at 8 p.m. when they're closed and not answering their phone to help you make decisions on what's best for you. And I think so much of pregnancy and labor is a lot like that. That's why I recommend everybody take a birth class. I'm going to link the birth class that I recommend down below. Now, great information in this video, but I want to be sure that you watch the original video. I'm going to link it up above and down below about ligament pains and also how to help them resolve. So don't miss that video. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared and maybe even save you a copay. Not scared for your upcoming hospital birth.